Hey guys, good evening. My name is NSAID Castan from the Pamantasan ng Luzon ng Maynila College of Nursing 25. Tonight, we will discuss about non-steroidal anti-inflammatory drugs or NSAIDs for short. So, here's the case. Miss Clark is being seen in the clinic for treatment of rheumatoid arthritis. The physician has prescribed naproxen for her pain and discomfort. Discuss the information you will give Miss Clark about detecting possible gastrointestinal bleeding. So first, what is rheumatoid arthritis? Rheumatoid arthritis is the most common type of autoimmune arthritis. It is caused when the immune system, or the body's defense system, is not working properly. RA causes pain and swelling in the wrist and small joints of the hands and feet. Now that we know what rheumatoid arthritis is, who is at risk? People who are aged 60 years old and above, females, have specific genetic traits, have never given birth, have obesity, and people who smoke tobacco or whose parents smoked when they were children. Now that we know more about rheumatoid arthritis, let's now discuss what NSAIDs are, specifically naproxen. NSAIDs are believed to work by suppressing the prostaglandin synthesis by inhibiting the effects of the enzyme cyclooxygenase. Now, cyclooxygenase has two types. COX-1, which helps maintain the lining of the stomach, and COX-2, which triggers pain and inflammation. Now, with that being said, we can now say that naproxen has anti-inflammatory function, an antipyretic function, and an analgesic function. Now, how do you take naproxen? You can take naproxen in 500 mg tablets or 1000 mg tablets, in 2 divided doses or in 1 single dose. But keep in mind, to never exceed 1000 mg per day, and to always take it with food. Now, what are some adverse effects that you can encounter while taking NSAIDs? You have dyspepsia, gastrointestinal pain, headache, insomnia, nausea, rashes, somnolence, and vertigo. What information do we give Miss Clark about gastrointestinal bleeding? First, we tell Miss Clark all about gastrointestinal bleeding. Gastrointestinal bleeding or gastrointestinal hemorrhage is all forms of bleeding in the gastrointestinal tract. Now, what are the signs and symptoms? The symptoms can either be overt, obvious, or occult, hidden. Overt bleeding might show up as vomiting blood or black tarry stools, while occult bleeding might show us up lightheadedness, difficulty in breathing, fainting, chest pain, and abdominal pain. Now, because of the action of the drug, Miss Clark can be more susceptible to peptic ulcer, a more specific type of gastrointestinal bleeding. Now, what is peptic ulcer? A peptic ulcer is the term used for a sore that occurs in the mucosal lining of the stomach, small intestine, or esophagus. When the ulcer is in the stomach, it might also be called a gastric ulcer. All NSAIDs have the potential to cause indigestion, gastric bleeding, and ulcers. However, some people are more susceptible to developing peptic ulcer diseases than others. Now, who are these people? It is important to note that taking NSAIDs alone cannot cause gastrointestinal bleeding or peptic ulcers. But there are also special considerations. Serious complications from peptic ulcers caused by NSAIDs are more likely to occur in people who are older than 65 years old, also take corticosteroids, have a history of ulcers, take high-dose NSAIDs, have an infection with H. pylori, use aspirin daily, and those who also take blood thinners. Now, it is important to let Miss Clark know to never exceed 1000 mg of naproxen per day. Why? Because that puts her in the 4th risk category, which is taking high-dose NSAIDs. And because Miss Clark has rheumatoid arthritis, we can also consider the fact that she is older than 65 years old, which makes her fall under the first risk category, which are people older than 65 years old. And because naproxen inhibits COX-1 or the protective lining of the stomach, it would also be useful information to give Miss Clark to avoid foods that can trigger acid in the stomach, like high-fat foods like French fries and onion rings, tomatoes and citrus like lemon juice and pineapple juice, chocolates, coffee, and spicy foods. So that is all for tonight. Thank you and God bless.